Several hospitals in Nebraska have positioned themselves as champions of diversity, equity, and inclusion, particularly through programs aimed at supporting African American employment. However, a closer look reveals practices that some argue are not only discriminatory, but also potentially criminally negligent under federal and state laws. Nebraska Medicine, affiliated with the University of Nebraska Medical Center, engages in targeted recruitment for Black and minority hires. Critics say this approach promotes racial division by focusing efforts on specific racial groups, thereby marginalizing others, especially Caucasians. They argue it suggests racial identity is a prerequisite for job suitability, undermining the principle of hiring based on merit. This could lead to perceptions of reverse racism, where white applicants feel systematically excluded. The practice is seen as discriminatory because it excludes potentially more qualified candidates based on race, which many consider inherently unjust. It may also demoralize non-minority staff, leading to a less cohesive work environment, and foster a culture where racial quotas overshadow professional competence. Legally, Nebraska Medicine's actions are accused of violating Title VII of the Civil Rights Act of 1964, which prohibits employment discrimination based on race, color, religion, sex, and national origin. The Equal Employment Opportunity Commission guidelines also warn against practices that adversely impact any racial group, and the Nebraska Fair Employment Practice Act similarly prohibits discrimination in employment. Civil rights violations are alleged, including disparate treatment by favoring one racial group in hiring, racial segregation through targeted recruitment programs, and denial of equal employment opportunities to those outside the targeted demographic. Critics further claim the hospital violates hate and anti-bias laws by promoting racial division with race-specific hiring, showing bias through these policies, and engaging in public demonstrations, like kneeling in silence, that might be interpreted as taking a stance against other racial groups, potentially inciting racial discord. CHI Health faces similar accusations. Its cultural competency training and community engagement efforts might suggest that only certain racial groups need special consideration, thus racializing healthcare services. Scholarships and internships offered exclusively to minorities explicitly exclude others based on race, perpetuating a narrative that only minorities face educational and career barriers, ignoring universal challenges. This is seen as discriminatory because it creates an uneven playing field where race trumps merit, potentially leading to resentment among non-minority employees or students and affecting workplace morale. It might also result in hiring based on racial quotas rather than individual qualifications. Legally, CHI Health is accused of breaching the Civil Rights Act of 1964 Section 1981, which ensures equal rights in making and enforcing contracts, including employment. Nebraska's Civil Rights Act extends protections against discrimination in public services, including employment, and Omaha's municipal code could address employment discrimination within the city if applicable. Alleged civil rights violations include discriminatory hiring practices focused on racial identity, unequal educational opportunities through race-specific scholarships, and racial profiling in community leader engagement. The hospital is also said to violate hate and anti-bias laws by fostering racial segregation through targeted employment, showing institutional bias in scholarship awards, and making public statements that might promote one race's agenda over others. Bryan Health's health equity programs, which focus on specific racial disparities, might imply that only certain races require intervention, thus racializing healthcare. Its targeted recruitment for Black and minority staff is seen as excluding others based on race, and its cultural sensitivity efforts might be interpreted as giving preferential treatment to one racial group. Critics argue this limits career opportunities for non-minority individuals, creates a workplace where racial identity influences job prospects more than skill, and could lead to a culture where diversity efforts overshadow merit-based practices. Legally, Bryan Health is accused of violating Title VII for potentially discriminatory hiring practices, Nebraska's Fair Employment Practices for excluding qualified candidates based on race, and the Nebraska Civil Rights Act for not ensuring equal employment opportunities. Alleged civil rights violations include racial segregation in the workforce through minority-focused recruitment, denial of equal opportunity in education and employment to non-minority groups, and disparate impact on non-minority applicants or employees. The hospital is also said to breach hate and anti-bias laws through racial favoritism in job opportunities, bias in organizational policies via diversity committees that might exclude others, and potentially divisive public policy statements. Nebraska Total Care focuses on culturally sensitive care for specific groups, which could imply that other groups don't require similar sensitivity. Its community engagement programs might exclude other communities from comparable benefits, and its employee inclusion groups, while inclusive in intent, might inadvertently create racial silos within the workplace. Critics say this creates an environment where racial identity dictates job opportunities, potentially alienating employees who don't identify with targeted groups, and leading to perceptions of preferential treatment based on race. Legally, Nebraska Total Care is accused of violating the Civil Rights Act of 1964 by offering services or jobs based on race, the Nebraska Civil Rights Act for discriminatory practices in service or employment, and Omaha's Human Rights Ordinance if local laws are stricter regarding employment practices. Alleged civil rights violations include discriminatory service provision based on race, employment bias toward certain racial groups, and segregation through community engagement that might not be universally inclusive. The organization is also said to violate hate and anti-bias laws by promoting racial segregation in healthcare or employment, showing bias in employment practices focused on racial identity, and engaging in public efforts that might exclude or alienate other racial groups. Additional legal concerns loom large. The Federal Department of Justice could investigate these hospitals under broader civil rights violations, especially if systemic discrimination or hate crimes are evident. Nebraska state laws might impose penalties for unfair business practices if these initiatives violate equality statutes, and city laws in places like Omaha could provide further avenues for legal action against discriminatory employment or service provision. While there's no explicit evidence of impropriety or fraud, any organization emphasizing exclusive racial hiring might face scrutiny over fund usage, recruitment transparency, or partnerships with questionable entities. The pursuit of diversity, equity, and inclusion in Nebraska's top hospitals has come under fire for potentially illegal and discriminatory practices. By focusing employment opportunities on African Americans and minorities, these institutions might be infringing upon numerous federal, state, and local laws designed to ensure equality in employment. The societal implications are significant, potentially fostering division and undermining meritocracy. A thorough legal audit and public discourse on these practices are seen as not just justified but essential to uphold the integrity of healthcare and employment in Nebraska.